So hello students, our today's question is on dental materials. So let us discuss them. The first question, an elastic impression material was poured using a, using a dental stone. So after some time, the poured model found slightly hot to touch. So one of the following statement is true for this situation. So your answer here will be heat is evolved during the setting of the dental stone. So it is quite usual because heat is evolved during setting of the dental stone. So it is quite usual for a poured dental stone to feel slightly hot on touching, because the heat it is evolved during the setting of dental stone. So dental stone, when mixed with water, it undergoes a chemical reaction that is known as hydration. So this reaction would generate heat as the dental stone hardens and sets. So therefore, a slight warmth or heat when touching a recently poured dental stone model, it is a normal occurrence and it is not a cause for the concern. So dental stone, when mixed with water, it undergoes a chemical reaction that is hydration. So this hydration reaction is exothermic, meaning it releases heat. So the heat generated during the setting of dental stone is due to the exothermic chemical reaction rather than the water to powder ratio, that is the option B. So while the water to powder ratio, it can affect the consistency and the working time of the dental stone, it does not directly cause the heat generated during setting. Third option, the cast pouring should have been delayed. This statement, it is not necessarily true. The heat generated during the setting of dental stone, it is a normal part of setting process. Delaying the pouring of cast would not prevent this heat from being generated. So it is more related to the chemical properties of dental stone itself. So your answer would be A. Moving to the another question. A patient approached the clinic with fallen recent composite restoration. So the pulp, it was protected with zinc oxide eugenol cement. So what could be the reason for failure of composite? The answer is D. Eugenol relieved from the zinc oxide would prevent the polymerization of the composite resin. So when composite restoration fails after being placed over a zinc oxide eugenol cement, it is due to the eugenol component that is interfering with the composite resin. So eugenol that is present in the zinc oxide eugenol cement, it can inhibit the polymerization. So it can do is, it will inhibit the polymerization. So that can result in a weak bond between the composite and the tooth surface. That could cause restoration failure. Option A, the composite materials, they are generally designed to have a good strength for restorative purposes. So option A is incorrect. Composite selection can play a role, but its more about its compatibility of the composite with specific clinical situation rather a general issue with the composite material. The strength of the zinc oxide eugenol cement is not a major factor in the failure of composite restoration. So it is the interaction between the eugenol and composite polymerization that is more likely to be the issue. So the eugenol relieved from the zinc oxide eugenol would that prevented the polymerization of composite resin. So that would be your answer of choice. A patient came to outpatient department for ortho treatment. Initially, during the impression procedure, the alginate impression got distorted due to the patient gagging. However, later, the dentist managed to make a good impression. How? Excessive alginate, it is loaded on the posterior portion of the tray and this region is seated last. So, your answer would be less alginate is loaded to the posterior and it was seated first. So gagging, remember gagging sensation. Suppose this one is a tray and more of the composite, more of the alginate is placed posteriorly. So that would lead to gagging. That is triggered by the stimulation of the vagus nerve. So use of the less alginate loaded to the posterior portion and setting it first, it is the common technique to minimize the gag reflex during an alginate impression procedure. So that is why a less alginate it is loaded to the posterior part and it was seated first is your option of choice. An additional silicone was poured by high strength stone in the dental laboratory. However, the cast could not reproduce all the fine details of cavity preparation. What might be the reason? Well, the reason of the cast could not reproduce all the fine details of cavity preparation may be that a hydrophobic impression material could be used. That is addition silicone, a silicone. So hydrophobic impression material will have a difficulty in capturing the fine details in moist or wet environment. So that can result in less accurate reproduction of the prepared tooth surface. In contrast, the hydrophilic impression they are designed to have a better moisture control and they can reproduce all the fine details more effectively in a wet environment like the mouth. So your answer would be C. Hydrophobic means it will repel water. Hydrophilic means loving water. Next question. If we mix gypsum in a boiling water, what will happen? So, if we mix gypsum in a boiling water, so the reaction would not occur. So, when gypsum is mixed with the boiling water, it does not undergo normal setting reaction. Instead, excess heat denaturates the gypsum, preventing it from setting properly. So, as a result, the reaction would not occur. And you won't get the desired hardened gypsum. So, that is essential to use water at appropriate temperature for mixing the gypsum material to ensure proper setting and getting proper strength. Moving to next question, the cement used as reference material to judge the potential of other materials to elicit a biological response. It is silicate cement. Silicate cement, particularly the calcium silicate based cement like MTA. So they are often used as reference material to assess the biocompatibility and biological response of other material. So they are excellent, they are known for their excellent biocompatibility, and they are used as a standard for evaluating the potential of other dental material to elect a biological response. So answer will be silicate. Moving to next question. Entrapped air porosity on the inner surface of casting sometimes is referred as it is back pressure porosity. So this back pressure porosity, what it can do is it can produce a concave depression caused by inability of the air in mold to escape toward the end of investment. So air unable to escape. That could lead to back pressure porosity. So back pressure porosity refer to the entrapped air porosity on the inner surface of casting that will create a concave depression, and it is caused by inability of the air in mold to escape toward the end of investment. The energy storage property of structure within proportional limit, it is known as a resilience. So the energy stored property of structure within proportional limit, it is resilience. Zinc oxide cement exhibit a faster setting rate when mixed on chilled glass slab that has condensed water on its surface. So the water, it is necessary to initiate the reaction. The reaction So zinc oxide cement, it relies on the setting mechanism that involves the hydrolysis of zinc oxide and subsequent reaction with the eugenol. So water, it is necessary to initiate this reaction, and it proceed more rapidly in a humid environment. So additionally, the presence of zinc acetate dihydrate, it can accelerate the setting reaction by supplying the zinc ions more rapidly. So therefore, when zinc oxide cement, it is mixed on chilled glass slab with condensed water on its surface, it provides a faster setting rate. So remember, when the zinc oxide, the zinc oxide, it will react with water to form zinc hydroxide. So zinc hydroxide, it will react with eugenol to form zinc eugenolate. plus water. So the set structure consists of particles of zinc oxide embedded in matrix of the zinc eugenolate. Moving to next question, when taking impression, the next step after seating the patient and placing the patient napkin is to prior to taking the impression, the patient must be informed of the procedure and process explained so that there is complete cooperation. So next step after sitting the patient and placing the patient napkin when taking impression is to explain the procedure to the patient. It is essential to ensure that the patient understands the process and it is comfortable before proceeding with the impression. So that helps in achieving cooperation and successful impression procedure. Moving to the next question, sublimation. Sublimation, it is a process of converting solid directly into the gas without passing through liquid phase. So there is no liquid phase. The solid is converted directly into the gas. Moving to the next question, what is the most accepted theory for setting of gypsum? The most accepted theory is dissolution precipitation theory. Three theories are there, remember, dissolution precipitation theory, hydration theory and colloidal theory. But the most widely accepted theory is a dissolution precipitation theory. According to this theory, the setting of gypsum products like plaster and stone, it occurs through the series of dissolution and precipitation reaction. Initially, the gypsum, it is mixed with water that leads to dissolution of gypsum particles. As the gypsum particles it's come in contact with each other, as the dissolved gypsum ion come in contact with each other in the mixing process, they undergo a chemical reaction and they start to precipitate back as gypsum crystal. So these newly formed crystal interlock and harder over time, resulting in setting and hardening of the gypsum material. Other theory are hydration theory, colloidal theory. So the most important and acceptable theory is dissolution precipitation theory. You are taking impression of patient and there is prolonged immersion in hot water or overheating of impression compound that may lead to, well, the prolonged immersion in hot water or overheating of impression compound. It can lead to leaching of some low molecular ingredients like stearic acid. So leaching of stearic acid from compound. So this leaching can make impression compound brittle. So answer is leaching of stearic acid make it more brittle. The next question, the stress strain curve of which of following material show a higher slope? So the material with the higher slope on stress strain curve, it is typically one with the highest stiffness or modulus of elasticity. So in this case, the gold alloys, they have higher slope on the stress strain curve graph, indicating a higher stiffness comparable to other materials listed above like elastomers, ceramic and enamels. So gold alloys, they are known for their relative high Young modulus of elasticity compared to other dental materials. So that makes them stiffer and less deformable under the stress. Moving to next question, as compared to the acrylic composite resin, they have the composite resin, they have increased water absorption. So composite and acrylic. So remember, composite have increased water absorption. So composite resin, they are known to have higher water absorption. Compared to the acrylic materials. So that means they can absorb more water over time. That can lead to changes in their property and affect their performance in oral cavity. So other statements, they are incorrect. Increased polymerization shrinkage. The composite resin, they have lower polymerization shrinkage compared to the traditional acrylic resin. Increased abrasion resistance. Composite have a good abrasion resistance, but it is not a direct comparison with the acrylic, as both material can have varying degree of abrasion resistance. Lower compressive strength. The composite, they typically have higher compressive strength compared to the acrylic materials. So which property of composite it is more affected by the size and number of fillers? So the property of the composite that is most affected by size and number of filler, it is the polymerization shrinkage. So polymerization shrinkage, it refers to the reduction in the volume that occurs during curing or polymerization process of the composite material. So this shrinkage, it is caused by conversion of monomer into polymer network. So that results in dense and compact structure. So the incorporation of fillers, so their size and their distribution, they can significantly influence the overall polymerization shrinkage of composite. So larger fillers, they act as an obstacle to the shrinkage, whereas higher number of fillers, it can create interfaces that will affect the polymerization process. So the polymerization process, which property of the composite is affected by size and number of fillers, is the polymerization shrinkage. A dentine bonding agent has two ends, hydrophilic and hydrophobic end. The hydrophobic end binds to, the hydrophobic end of dentine bonding agent, it binds to the composite. The hydrophobic end would bind to the composite resin. So that interaction helps in creating a strong and durable bond between dentine and composite. So that will enhance the longevity and performance of the restoration. Whereas the hydrophilic end of the dentine bonding agent, it binds to the collagen in the dentine. So that is important for stable and durable bond between restorative material and natural dentine within the tooth. So here the hydrophobic end is asked. So hydrophobic would bind to composite. So answer would be composite resin. And if the question was asked hydrophilic end binds to, then the answer would be collagen in the dentine. So which of following is not an impression material which sets by irreversible reaction? So Impression material which sets by irreversible reaction. These are the irreversible that sets by irreversible, and it is the agar, the hydrocolloid, which is reversible. So your answer would be agar, as it is reversible. Remember the classification of impression materials, elastic and non-elastic. Moving to next question, the shape of indent in Knoop's hardness test. So Knoop hardness test, it employs a diamond shaped tube that is cut in the geometric configuration. The impression, it is a rhomboid in outline, and length of the largest diagonal it is measured. So the load, it is divided by projected area to given Knoop hardness number. A alginate impression was taken of patient with a fixed appliance, and the tearing of impression occurred in critical area as result of severely undercut areas. So choose the incorrect option. So the incorrect is mixes with low powder ratio have higher tear strength. So the tear strength of alginate, it tends to increase with a higher powder liquid ratio and not the lower one. So a higher powder liquid ratio result in thicker mix, more viscous mix that will have a higher tear strength. So that is because a thicker mix, it is less likely to tear during removal from undercut area or when or subjected to forces during removal from the mouth. Moving to next question. A mix of alginate was made and setting time was shorter than previously experienced. The material was too stiff at the time of insertion to obtain adequate setting and surface detail. All of following are cause of this problem except. So most common cause for the shortened setting time is too high temperature of mixed water. So using a water that is substantially colder than the recommended temperature for mixing alginate can actually prolong the setting time, not shorten it. So colder water tends to slow down the setting reaction of alginate, leading to colder water. It will slow down the setting time. It will slow down the setting reaction that leads to longer working time. So using the water at lower temperature, it can cause the material to be fluid at time of insertion rather than too stiff. So the other statements correctly identify the cause of shortened setting time for the alginate. The second option is the aging of alginate powder in warm, humid atmosphere. It can affect the setting. The increased amount of powder causes the setting or gelation time to be lesser than the normal experience. Which of following is known as micro hardness test? Well, noob hardness, it is known as micro hardness. For bonding to be effective, the wetting angle should be minimum with the hard tissue. So remember, for bonding to be effective, it should have minimum wetting angle with the hard tissue. That includes both the enamel and dentine. So wetting angle, it describes how well a liquid spreads on the solid surface. And a smaller wetting angle, so if the wetting angle it is smaller, less than 90 degree, it indicates a better wetting. So it is due to the feature of the surface tension. The surface tension, it is a property of liquid that arises from the cohesive forces between the molecules at the liquid surface. So wetting angle, it is known as the contact angle, that is angle formed by intersection of the liquid surface and the solid surface. So if this angle is is acute or less than 90 degree, then the liquid has solid attraction to the solid surface that encourage it to spread out and wet the surface effectively. So when the wetting angle it is less than 90 degree, the liquid tends to wet the surface, spreading out, making a good contact with it. So when the angle it is greater than 90 degree, so when the angle it is greater than 90 degree, it indicates poor wetting and liquid tends to bead up rather than spread out on the surface. So zero angle means perfect wetting, and contact of angle of 180 means there would be no wetting. So wetting angle should be minimum. The setting time of gypsum it is measured through Inicet needle. So Inicet needle, it is a laboratory apparatus that is used to determine the setting time of cement, gypsum and other materials. So it consists of a Inicet apparatus that consists of a metal frame with vertical guide rod. It has needles. Inicet needles comes with various different diameter and shape. So Inicet needle it is allowed to penetrate the surface of the sample under its weight as the material tends to set. So needle penetration depth it is measured at regular time intervals. So setting time is determined when the needle no longer make a significant impression or mark on the material surface. So that indicates that material has reached a certain level of hardness and it is no longer in plastic or a flowable state. So image shown in this procedure, it is acid etching, it is done. So most common we use is the phosphoric acid. When mixing with water and gypsum, which of following should be added first? Well, the water should be added first, as the gypsum product it can be poured in small quantity. So water should be added first when mixing water and gypsum. Adding water first allow for better control over the mixing process. You can add the gypsum product slowly and gradually while monitoring the consistency of the mixture. So that helps to prevent the lump formation. So other is there is a reduced risk of air entrapment. Adding water first minimize the risk of the trapping air bubbles into the mixture. Or by adding water first, you can also adjust the water to powder liquid ratio more accurately to achieve the desired consistency for specific dental procedure you are performing.